Yeah.
I was on Dental Town. So for those who don't know, this is like the world's largest community of dentists. It's a free site. You go on there and people talk about how to run a practice, financials, clinical skills, like anything you can think of. It's a fantastic community to learn from, because you can see what everyone's doing, and people share a lot of knowledge. So somebody on there made a post about before and after photos. Now, I've always kind of hated the way 99% of dentists do these photos, because they look terrible. The camera is bad. The quality of the lighting is bad. It's like often they put them up against the wall like it's a mug shot, and they take a photo of their face and they put that little black line across the eyes for privacy. And for me, the impression is, it's like, it looks like I'm looking at a body, like a crime scene photo, right? Like it's what do you think is going to happen here? Like the only people this is going to impress is other dentists, right? Because a dentist has the clinical knowledge to look at what happened there and appreciate the level of work that is being done. But your average patient doesn't see that. They just see this gruesome looking photo. And in some dentists, they put their worst cases, like somebody who comes in with like looks like they're a crackhead, the teeth are missing. And I honestly think some patients, the impression they get is like, oh, maybe this dentist specializes with like people that are in like the carnival or something like that. Like, I just have a small problem. Maybe this isn't the right place for me. Right. So you posted how you guys do your before and after photos, and I was really impressed. So like, we're going to put some of them up on the video so you guys can see, but they were at a level that, I could tell these people really understood how to sell the image, the emotion behind it. They really know how to put the spotlight on the patient, that I'm not trying to showcase my clinical skills or what tools I use or the sophistication of the procedure. Like, I'm really trying to show how much we've improved this person's life and how great they feel. And what they were dealing with before, and the challenges that they were facing because they weren't happy with their smile, and how they feel afterwards. So I realized, like, these people really get it. They understand how to create the right content that would engage someone on an emotional level. Because ultimately it's an emotional decision. No one's going to come in and pay for, 30, 40, $50,000 implant case because they're impressed with the type of implant you place, or the composition of the implants, So I reached out to you and I was like, who does this for you? This is really good stuff. And I was surprised when you said, nobody does, like, we do this. This is a part of our in-house capability. We realize, like, we really need to have this in, it's not something we paid for once. It's something we do ourselves. We bought the equipment, we set up the right space. So walk me through that. Like, sort of, did you just like photography? Like, did you have a passion for it, or did you realize this is what we need to do to stand out? It's, this is the type of stuff we need. So what was your thinking behind doing all this stuff?
Yeah, it's a great question. And it's one that I think a lot of dentists do ask. They're asking themselves, they have a vision of where they want to go. And that vision is usually influenced heavily by what you see on, whether it's Instagram or Facebook or Dental Town or wherever. But there's that hard part of understanding actually where you currently are. I think it's like the part that everyone skips past is like, where are you actually at right now? What's a true awareness of what your capabilities are? So I was not a talented photographer. I didn't know what an f-stop was. I didn't know how to adjust that, shutter speed. I knew nothing about any of that. So what it came down to was an awareness, first off, that, okay, I have no idea how to create that. But the reason why I want to create that is because I do want people to have an easier experience saying yes. And I think that's probably one of the bigger, like, macro values here, Nick, is that if you've used the word sale a couple of times, right? Sell or sale. And that's a word that most people on the planet, not just dentists, have an aversion to, because it feels like you're doing something to someone.
Like manipulative, you're trying to influence them. And
yeah, right. You're going to convince someone of something that they maybe don't want. And I think that is because a lot of people do treat it that way. A lot of people are manipulative in the way they approach it. But if you're good at what you do and you believe in the talent that you have, and you believe that what you do is for the betterment of those that are on the other side of it, then actually all sales really is getting more people into your sphere of influence so that you can help them. And so I look at sales very much as not what you do to someone, but what you do for someone. And that was a very motivating factor for me to saying, okay, well, then I need to figure out how to make it really easy for a person to say yes. And the best way to do that is to know what you're buying. If you go to a dentist, we all know this, there's some dentists that you let in your mouth and others that you definitely wouldn't. And the way you judge that is by the quality of the work. Now, as dentists, how do you present that in a way that's not scary to the patient, but also informative? And that was really where I wanted to take things. So spent a lot of time and money hiring actual photographers to help me. So I was trained by photographers, like, here's what I would do here. Here's how you take portraits of people. And we started to basically create a system behind that. And what I found out is that it was kind of complicated, quite honestly, Nick. It looks easy
when you see an expert doing it, but the reality is like, that's the brilliance of it, is that the people that are really good at it, they make it seem easy. But when you break it down, there's actually a lot of depth and nuance to many of the elements.
Yeah, 100%. And so I was very aware of like, man, I'm not sure I can replicate this. Like, you guys are teaching me, that's cool, but this is very difficult stuff. And at least it felt that way. And the more we kind of worked with it, we started to develop a system that then the photography was very doable. The problem was then, like, how do you insert it into a workflow? The workflow piece is huge for a dentist because I always have, there's 3 words for people to write down in your audience, 3 words that kind of, if you go back to these over and over again, it's gonna be very helpful for you. The first is where you start, or where you want to end up, which is success, right? Success is where we all want to be, no matter what it is, whether it's your relationship with someone you love, a friendship, your business, your dentistry, you want it to be successful. For it to be successful, it has to be sustainable, right? Dentistry has to last. Your marriage has to last. Your friendships have to last. And so sustainability is like that one step back. But for something to be sustainable, meaning you're able to consistently do it over and over again, it has to be simple.
Okay. Interesting. Yeah.
So the very, very crux of it all is like, that was the question I kept coming back to, is, can I make this more simple? Can I make this workflow like 5 minutes to take all these great photos? Can it be that easy? And could I even train a staff member to do the same thing that I'm doing so that I can keep producing and they can hammer this all out? So that was the question. And honestly, we didn't have an answer for it at first, but we kept refining and refining. And we've been doing it for about 6-7 years now. And now it's just that. It's something that's very, very doable for anyone.